Okay, I'm going to take you on a tour of our Rasmussen hospital so you know kind of where things are and the way things are going to work. The first thing that I want you to note is the board. This says what rooms are involved, who the patients are, what doctor is involved in that patient. You'll be expected to write what nurse is assigned to which case when you figure that out, as well as what student nurse you're going to assign to that nurse or patient. There are also some notes that are over here specific to the patient. NHY means not here yet. MPO, on call to the OR, and one of our patients actually has a sitter. The other thing to know is that we have food trays. So it's morning and you have some food to bring to your patients. So you would send your student nurse or yourself to come and get those food trays. They will be labeled appropriately for what patients you have. We also have our telephone. We want you to use this just as you would any telephone. It is not actually connected to anything, but if you pick up the phone and you say, Dr. McMillan, we will answer appropriately. Talk to in the phone as if you were actually talking to the physician or dietary or lab or whoever it was. Just be sure to announce who it is you're trying to call. You may on occasion see somebody come in, maybe a doctor doing rounds, and that will be marked appropriately, so Dr. Vidya. And if, say, lab has to come and draw blood, the lab person will come into the room. If the doctor comes in and writes a new order, you will see a flag in the chart. Just be aware you need to look for those just in case. Okay, so show you where all the rooms are. The way the rooms are set up is we go down this side of the hall, 101, 102, 103, 104, and then it starts with 105 down at the far end, 106, and then our only two-bed room is 107A and 107B. You'll notice these clips that are here in place. They will be removed at the places where there's actually a doorway when we start the simulation. However, if you are in an area that has a clip still on the curtain, that means it's a solid wall and you cannot pass through that area. Follow me down here. Every patient has their own medication box, okay? So hopefully you won't need to look for any medications. However, there may be times when there's a medication that's not in the box for some reason. Either it's a new order, it's been used up, or whatever, in which case you would have to call pharmacy and request that medication. We have a lot of supplies up here, needles, gloves, syringes, those kinds of things are up in this area. There's some IV equipment, dressings, tape, that kind of stuff in here. And down here, there's usually some catheterization kits, potentially a urinal, bedpan, that kind of thing. In the event that you have to do a blood sugar on a patient, got your little glucometer. And I also have lancets which have already been shot off, so you're not going to stick somebody's finger, and those are the ones that you will use. You can actually go through the motions if it's a live patient, prick the finger, so to speak, and that person will put a little drop of blood for you to test so that you'll get a reading. Let's see, all your vital sign equipment is there. You will note that there is a white basket here. While you're going through your simulation, you may remove certain things from a patient and you think, I wonder if they wanted to keep that. If you have any question in your mind that it might be something that we would want to reuse for another simulation, just throw it into this white container. In that room we have the linens. There's also an automatic blood pressure cuff. We would prefer that you do manual blood pressures. I know that's going to be difficult for some of you who haven't had to do them for a while, but it's really good practice, so I encourage you to do that. Let's see, I said vital sign equipment. I think that pretty much covers it down at this end.